Hello world, this is Dr. Kundlas. Today we'll be discussing about sujetry. Imagine a patient in constant pain and the only solution is chronic opioid therapy, which has complications, multiple side effects, and very high likelihood of leading to addiction. It will remind you on day in, day out, pain and suffering. Finally, we have a medication which will provide pain relief without the pulse of being addicted, side effect and complications. On January 30th, 2025, FDA approved a new medication after 20 years for pain relief. This medication was developed by pharmaceutical company Vertex. We could differ how the pain is initiated, but what we know for fact is the way the pain travels in your nerve through electrical current. Medically, we call it action potential. Inside your cell, there is a negative voltage. We call it resting membrane potential. That is normal. Whenever there is a stimulus, sodium ions enter through channels and start the electrical activity. To stop this propagation, potassium seeps out of the cells, and this process keeps on going all the time. There are other electrolytes like calcium, magnesium, which affect this process. Then eventually, neurotransmitters gets involved and the whole cascade of electrical potential keeps on going. Sujetry blocks specific sodium channels. We know that there are 6 different kind of sodium channels, and these different kind of sodium channels present in different part of the nervous system. Some are in the central nervous system, brain and spinal cord. Some are in the organ systems. Sujetry specifically blocks NaV 1.8 sodium channels present only in the peripheral nervous system. It has nothing to do with the brain. That is where uniqueness of this medication lies. Because it blocks the sodium channels only in the peripheral nervous system, it does not affect your brain, so there is no fear of addiction, there is no fear of you being euphoric, no fear of central nervous system complications, a major breakthrough. I think there will be a race to develop better medication, and in this process, we as consumer and healthcare provider win because we will have better medication to take care of your pain. How this medication works? This medication blocks NaV 1.8 sodium channels, and those sodium channels does not let the cell to get depolarize or start the electrical activity and stops pain sensations and you're pain free. It has been tested against placebo and conventional narcotic medications like hydrocodone and oxycodone. It was as effective as hydrocodone or oxycodone without all the side effects, and definitely it was a lot more superior to placebo. Whenever we do research, every medication has to be compared with placebo because our body is the biggest chemistry lab and it can produce a lot of chemical reactions, processes and changes which lead to significant improvement in processes. Sujetry trials has been going on for last 5 years since they recognize specific NaV 1.8 sodium channels. They tried thousands of products and then eventually they found sujetry, marketed as Genrovax, being very effective. Initially, it was given a name 548VX. These names are important because you could know the evolution of medicine. Innovative research is very difficult. From physiologically knowing something, then finding a product which will work, and go through thousands and thousands of products which eventually work. What are the clinical benefits of sujetry over conventional opioid medications? They are safe, effective, non-habit forming, no fear of addiction, no fear of dependence. It can be combined with other medications safely. This medication needs to be loaded in your body and then you go on a maintenance medication. You should take Sujetrine 100 milligram pill on first day. From day 2 to 4, you take 50 milligram twice a day, and then day 5 onward, you take 50 milligram of Sujetrine, 1 pill a day. This medication has significant interaction with your food. It should be taken either 1 hour before or 2 hours after your major meal. This medication is metabolized through your liver, so avoid taking any medication which is also metabolized through the liver. We try to minimize medication which use the same liver pathways. I am very excited because this medication will help us navigate pain medication epidemics. Though this medication is approved for acute pain, for a shorter duration, especially in Florida, we deal with elderly population. There are 2 kinds of pain medications we could use: non-steroidals and narcotics. By the 4th quarter of life, kidney functions are impaired in stage 2 or 3 disease where non-steroidals are contraindicated, and narcotic pain medications make them more confused and high risk for fall. I think once we find these alternative medication, we will be serving a lot of people safely and effectively. We as a medical community believe, and I am very sensitive to narcotic medications. Do you know that 75% of the drug overdoses related death in the United States are related to opioid medications? Unfortunately, this is a sad affair, but it's true. This new medication provides us a new way to treat your pain. It's approved for acute care, used in bone pain and soft tissue injuries and for soft tissue surgeries. But as we accumulate more and more data and we are more clear about the pathophysiology and the receptors and the sodium channels, I am confident this medication will be approved for other indications. I'm thankful to Vertex Pharmaceutical for spending so much of time, effort, money, and going through thousands of products to find one which works. This will lead to more research and development. Thank you very much.